Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Roundtree.
Welcome back to Healing at the Speed of Light, your weekly laser therapy podcast. I'm your host, Dr. Jason Roundtree, and we are talking today about using laser therapy to help musculoskeletal pain. And we're going to be looking at the research for this. It's a pretty neat systematic review. Now, a systematic review is a special type of study that combines a whole bunch of other studies together to kind of answer the question, overall, do we have this particular effect? And this one is looking at pain on these musculoskeletal disorders. And so these are pretty nice conglomerations of research because they take out some of the weaknesses. When you're looking at just one study, maybe those researchers had a particular way they were doing it that was different. Maybe they used equipment that was different. And this study actually used 21 different trials, combined all of those, and said on the overall, what are we looking at for the effect of laser therapy on musculoskeletal pain? So musculoskeletal pain, first of all, that's referring to any kind of painful condition with the muscles, the joints, the skeleton, so the bones. That includes connective tissues in most cases too, like ligaments and tendons. What kind of conditions do we see that will, kind of fit under that musculoskeletal label? Well, that's going to be things like arthritis, sprain and strain injuries, where you actually twist or damage the connective tissues. Things like tendinitis also fit into that category. So a whole lot of different issues that go into this musculoskeletal pain category. What it doesn't include is anything neurological, anything nerve-related. So neuropathy, pain, damaged nerves, traumatic brain injuries, headaches, things like that. But if we're talking about joints, bones, muscles, and this is a great study to look at. So this was published in 2017 in the European Journal of Physical and Rehabilitation Medicine. And like I said, they pulled 21 different trials from the 5 years preceding this study. So they really took a pretty narrow view, and they were very selective on what they wanted to look at. So first of all, only those musculoskeletal disorders that involved pain were included. And also, they wanted to make sure that the studies they chose for this review did include a sham or fake laser used alongside a real laser, so they could help to limit the effect of placebo. And if you've heard of placebo effect, that's where a patient thinks something's happening so they can imagine some level of results. And that's one of the criticisms I've seen for some laser studies in the past is that, it was just in the patient's mind. They're just making it up. They just think they're feeling better. And these guys just went ahead and said, no, if there's not a sham laser, a fake laser being used alongside a real laser, then we're not going to look at it. Or at least they wanted to make sure that they had regular care, usual care, versus usual care plus a laser. And all that means is that if somebody was doing physical therapy exercises for their knee pain, that they compared somebody who was doing just that to somebody who got the physical therapy knee exercises and laser to see if there was a difference between those two groups. Okay, that sound good so far? So this study is just a whole collection of other studies, 21 other studies on laser, specifically about pain with musculoskeletal issues. And here is what they found. Number one, they found that laser is an effective treatment modality to reduce pain in adult patients with musculoskeletal disorders. And they further went on to say, okay, what is the really effect compared to a control? So a control is that sham laser or fake laser, or it's that other group that's also doing exercises compared to the group that's doing exercises plus laser. So they said, look, this analysis presents good evidence for the use of laser therapy in the treatment of pain. Good evidence is kind of hard to come by in science, and especially in non-invasive modalities like laser. when you see something that says good evidence, that's a pretty strong statement. Now, it's not as high as some other categories could be, but keep in mind that even over-the-counter medications often return a low level of evidence or a poor level of evidence for their use. And spinal fusions and the long-term spinal fusion surgeries come back with poor levels of evidence that they're actually helpful. So when we find something that has good evidence for use, when we're talking about pain with musculoskeletal, we should sit up and take note that laser therapy is being shown here in this particular study to be quite effective for these painful conditions. All right, the next thing they did is, because they were looking at all these different trials that were run, these trials were actually run on different body parts. Some were on the back, some were on the knee, etc. And so they said, does the pain relieving effect of laser therapy, does that have any difference as far as where you put it? Like, doesn't matter if it's the wrist, doesn't matter if it's a shoulder. And what they came out with was pretty much it doesn't matter. It doesn't matter if it's the knee or the wrist or the shoulder or the back. That all those groups got better, and they weren't necessarily that much different from each other. So they did say a little bit about, look, the dosage is important. Getting the dosage correct is an important step in getting good results. And they also said the complexity of getting the appropriate parameters, like the settings for the laser, the treatment frequency, how often the patients got treated, all that is very difficult still when we're talking about laser therapy, because there aren't really good standards out there that have been shown to work. So those are the kind of two difficulties there, is making sure you get the right dose on your laser and making sure that the settings for the laser, the treatment frequency and so forth, making sure that's all done in a manner that we know should be effective. So that leaves us with a couple of takeaways. Takeaway number one, and the biggest one I want you to go with here, is that laser does well for musculoskeletal pain. This is a great study to be able to look at not just one group of patients, but multiple different groups of patients, multiple different groups of researchers, different types of lasers, different locations in the world where these studies were done, and to be able to pool all that information together and come away with the statement that there is good evidence for the use of laser in musculoskeletal pain. That says a lot for how valid laser therapy can be. But you got to get the dose right. You got to get the treatment right. You got to have the right technique. Proper technique goes a long way. Now, any laser is going to be better than no laser. That's another thing that we can get from this particular study. But if you want to get the best results in the fewest number of treatments, you need to be going to see a laser therapy provider who knows what they're doing and who's got the right kind of equipment, got the right kind of technique, the right kind of settings. There's a few of them out there. There really are a number of people that know what they're doing with laser. It can be tough to sort through those, so I would encourage you to take a look at Laser Therapy Institute member clinics. You can find a Laser Therapy Institute clinic near you. If you just go to our website, there's a link that says find a provider. You can click on that and see if you've got anybody near you. If you're having trouble using that, or you just want to check in with us, you can email us too. Email us at info@lasertherapyinstitute.org. We'll be happy to check out what you've got going on and help you find someone who can get you good, effective laser therapy for musculoskeletal pain conditions. So, thanks for joining us this week, and we'll see you again soon.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.